Hi, welcome to Reset Revolution. I'm Natalie Delsa, today your host, and today I'm here joined with Colin Zhu, who will be discussing issues with concerning mental health in men. So, Colin, do you want to give us a little bit of background and kind of introduce yourself before we get into it?
Yeah, so I am 17. I'm a senior at Dartmouth High School in South Coast, Massachusetts. So obviously I think I present pretty much as male, and that's why I'm talking on the subject. I use he, him pronouns. I've pretty much remained cisgender throughout my entire life, and that identity has been a part of like me and my mental health growing up. So I come from a family with like a long history of mental health disorders and illnesses that have just been, for the most part, untreated. My family, I'm first generation American. My family comes from mainland China. As some people may or may not know, mainland China is generally like not considered the most considerate of mental health, especially not for men or women. It really is just not even a concern in the country, and the lack of resources is very shocking compared to our standards in America. So I've had many of like my family members die to suicide, and I've had a lot of issues with that in my past. So I know that I'm personally predisposed to like schizophrenia and early onset schizophrenia just due to a genetic composition in my family, and it's personally made mental health like a really big consideration and a factor in my life and how I can stay like on top of my own mental health and help the mental health of others. My mom is a sufferer of like chronic schizophrenia, bipolar disorder, and multiple personality disorder. The diagnoses are a little bit jumbled between doctors that we've seen, and she's been in and out of mental hospitals throughout my entire life. I've seen it from the best to the worst, and unfortunately, mental health in Chinese culture just really just doesn't coincide very well. A lot of Chinese culture and tradition is based off of a rejection of tested Western medicine. It's a pairing of issues with culture, and it's an issue of East versus West propaganda mindsets in the current culture and society. So like a lot of Chinese people, they won't take their medications regardless of if it's for mental health or not, just prescribed by doctors. And it's also a common trend in mental health patients where they just won't take their medication because they suddenly feel better. And it's just a cycle. It's a cyclical motion of just intense drama and outbursts, and it really affects the people who are related to those who suffer from mental illnesses and live under the same household. And that's like a perspective that society generally just doesn't even consider. Like, there's so much more to mental health illness beyond just the patients themselves, but rather like the impacts they have on everyone. Um, yeah, so that's like pretty much why I'm interested in mental health and why I've personally taken a big passion for it.
Yeah, I think it's really good that we're talking about this today because, like, if it were me, like, I would have never known that was an issue or like a trend going on in mainland China. I just wouldn't have considered it. That point also reminded me of the entire I don't know if you remember the plantation politics discussion we had at Brown. It's interesting how like minorities tend to always get the short end of the stick when it comes to mainly everything, especially mental health.
Mhm. It's
So
definitely like a big disconnect,
yeah,
and
definitely.
we're gonna need to like bridge it somehow.
Yeah,
It's
it's definitely a complex issue that we need to bridge as society, but I think it's really important to start building that up right now. So the next question is, what are some of the biggest red flags you see in how society handles mental health in men today?
it's odd, right? So our society doesn't explicitly shame mental health, but it's like a connotation of the idea and stuff like that. So it's hard to ignore the big red flags when you live in a society like America, but like from an outside perspective, it's hard to like pinpoint specific things. It just more or less like the results and outcomes of if you tell people that you're struggling with mental health, and it's like you can't specifically blame the individuals, but it's more of like a social cultural connotation. Saying you're suicidal as a man will often get you reactions like, "Oh, man up to it, you're a pussy," etc., etc. Like women are generally more likely to be diagnosed with depression, anxiety disorders, and men with substance abuse disorders, and whatchamacallit, psycho like schizophrenic, like aggressive hallucination disorders. So it's a big part of it is like if you're depressed and as a man, it's oftentimes more or less society will react with you have more somehow more control of your mental health than a woman. Like you, why aren't you exercising, et cetera, et cetera? You could be doing this and this and this. The blame suddenly transforms to you, and it's a very toxic mindset. A lot of people are like, man up to it, you're a pussy, etc., etc. People will refer to you as a girl or like a woman for expressing your mental health, and just because of this like societal stigmatization and stratification of mental health with the female gender than the male gender. So if people want to be identified as their own gender, which most of us would like to be, it's difficult to want to come out and say this. It's like coming out as a man and saying you like wearing a dress. I get that that's like a hyperbolized example, but in the vein and like perspective of men, it's a very similar like awkward position to take in society, where if you're openly talking about your mental health, it's shown as a sign of weakness and therefore more femininity. Somehow it comes down to, yes, a little bit of toxic masculinity, but toxic masculinity is also like a small piece in the cog, like a small cog in the system.
Yeah, definitely. And I think it's interesting how like so many like men, they've just grown up in this cycle of toxic masculinity throughout their like kind of patrilineal line, that sometimes they like implement the toxic masculinity into other men themselves, you know?
Yeah,
I think it's really interesting how it's like an ongoing cycle that's kind of caused by itself almost.
yeah, for sure. It's weird, and it's partly like male mental health is obviously not an issue helped by a small fraction of men. Some men will aggravate and make it worse, but like that could be said about like a lot of populations. Like so people like, frankly, like I am a feminist, I am an egalitarian, I believe in equal rights and equal stances for men and women. At a biological level, like women have to endure different things that men can't experience and things like that. And that's a completely like valid difference between men and women that we should understand. But like when it comes to like the brain and mental health and stuff, that should all be equitable and accessible. And frankly, it just um whatchamacallit, so I lost my train of thought. But so men are generally victims of toxic masculinity, whether or not they know it, right? And toxic masculinity can also be like societally portrayed not even by men. I think toxic masculinity kind of phrases it as this like binary relationship between men and women, where men are toxic to women, but it can also be just expressed through a cultural double standard, right? Like people will be like, oh, it's different because you're a guy, or people like girls will say it too as well. Like people will say, will make boys are all pigs, boys are all slobs, boys are all messes, etc. And I think it's more, I think a big red flag in society is how that's like generally accepted. It's more or less more acceptable to make generalized derogatory comments about groups of men than it is to do that about groups of women. Groups of, especially when it comes to mental health, be like, all men should just man up and hear all this. I grew up in a relatively progressive state, Massachusetts, for the majority of my life, and you'll still hear it in states like this. So I can only imagine how different and more complex this issue could be across the country.
Yeah, I think it can definitely stem from like outdated concepts of like, oh, the man provides for the entire family and everyone relies on him. He has to be like the big, strong guy. However, that's not really true in today's society. And I think people don't realize that shift. And even back then, like it's still not okay to invalidate men's mental health. However, I think it's made more apparent now that, yeah, I just think it's interesting how we as a society, we've completely changed the way our demographics like really work. However, we still haven't changed our mindset.
Yeah, and it's also like we come up with all these um all these like derogatory terms for like mental health disorders, which are commonly diagnosed for men, like substance abuse disorder. We'll call them junkies. We'll throw them in prisons. It's also a fall of our American prison system, and it's not a sympathetic cause as opposed to a common mental health disorder of women like anxiety or depression, etc. Like I've grown up with depression and anxiety, and it's like not accepted. When I tell people I'm anxious, they would be like, "What are you anxious for? Why do you do this? Why you have no balls, etc., etc." It somehow always comes back down to like your gender, your ability to man up, and you should become more capable to overachieve, like overcome these issues just because of your genitalia or your chromosomes or however you want to identify gender. It's an irrational connection, but it's one that we all seem to just have in society.
Yeah. And stepping back to like your whole like kind of junkie ends up in prison kind of stereotype that ends up with it. I really think it's like disgusting how we just throw people in jail for first time like drug abuse when in reality they should be getting, mental help, therapy, etc. Like I think our justice system is completely whack.
Yeah, our prison system is definitely not intended for rehabilitation as it should be. I think people have some personal qualms with the idea of rehabilitation as a form of prison as instead of like punishment, which just it's irrational. But currently like our drug classification system and all of that, it's really messed up, and it ends up leading to a lot of men being arrested for drug charges when they should be getting help, because it's been found that it's like statistically more common for men to be inflicted by substance abuse disorders. And like we see it all the time in like the occupations of our society, like even the fact that I know the draft isn't still relevant today, but generally we have more men signing up for the military, and we force all boys at the age of maturity to sign up for the draft. We're generally, as a society, saying it's more comfortable to put men into a position where they're more likely to receive injuries, depression, anxiety, PTSD. And when you're in the military, if you get injured, you could be hooked onto like addictive pain-killing substances, which also sends you down another path of substance abuse disorder, which feeds into the overall cycle again. So it's small things like that where like men are more likely to be put into dangerous jobs, things like that, which just doesn't systematically help the problem.
Yeah, it's definitely like with the entire government system, it's like a shut down all issues paradigm rather than hey, let's help our people paradigm.
Mhm,
So the next question I have is we kind of actually already went over it.
mhm.
It's what role do you think toxic masculinity plays in mental health? So I'm just gonna skip over to the next one.
Yep.
In which ways do you think men's mental health is addressed differently than women's mental health? We kind of went over it too.
Yeah, I think
To add
it's
on it.
I think like men, this has like been scientifically documented, men are more likely to be violent, they're more likely to be aggressive and make all these poor decisions when they're suffering from mental health disorders. And it's odd because we're inversely like treating men in society, like despite knowing all these risks of having a significantly poor mental health condition of the male population in America, we choose to make these actions which for the most part are like not specifically targeting this population in society. So I think like the men, we don't really receive support groups as much. Like we don't feel like we're supported by our peers. We don't feel like we have open people to talk to about stuff like this. It's a weird, like male mental health, it's seen as an like issue, it's like a personal problem you can overcome, and not really legitimized as a disease or like a mental health illness. You know what I'm saying?
Mhm.
It's not as validated, and I think that validation needs to come over time with like information and media and just changing with the generations, and it's definitely not a change that we're going to get anytime soon.
Yeah. So kind of what you're saying is that you think society should provide men with more of a backbone when it comes to mental health issues, rather than letting them fend for themselves, which I completely agree with as well. So the last question I have today is why do you think it's important that we talk about mental health today, and specifically men and society rather than just women? Um, this was the slightly controversial
Yes.
question.
Okay. So I
But
personally,
yeah,
I personally like thought this question was a little bit self-explanatory, but I think this question is a good question because it presents like the devil's advocacy perspective. I'd like to compare this idea to like what people say to the Black Lives Matters movement. Like, yes, there are statistically more white people being killed by police officers in the nation than Black people, but that isn't proportionate to the population. It's all about proportions, percentages, and likelihood of being targeted. Because when you look at it by percentages, the percentage of Black people being killed by the police are through the roof compared to the percentage of white people. It's just because you're likely to have more encounters if you have more people in there, which makes sense. So it's like people say all lives matter, et cetera, et cetera. They will take this selective, like hard number that isn't a percentile of white people, and they'll use it as like a martyr. They'll use it to shut down the Black Lives Matters movement and all of the validity it has. And it's important that like when we say Black Lives Matters, it's because we're emphasizing that we need to put support on this crucial population that is facing explicit discrimination at the moment, and higher than like other levels in this issue in police brutality for that kind of movement. In this type of issue, it's like we see men killing themselves like 2 to 4 times more often in Western nations, and it's in staggering difference, especially when you look at like higher occupations like ER doctors and stuff. Male ER doctors kill themselves at like 6 times the rate of the general population, females at 3 times the rate. And obviously that's not good. We should have more mental health services for medical professionals. But just even those small differences you can see in occupations, you can see in general populations, that men are killing themselves at a higher rate. Suicide is such a major issue, and it doesn't help the overall other issues that we're facing in America, because self-harm and suicide by gun are counted into like firearm deaths and gun deaths, which throws off statistics. It makes guns more of a problem in the US. People are dying, and it doesn't help any of society by just ignoring this problem. I think like a lot of progressives can agree that we have a major issue with trans people in society, for people transitioning between genders. And a commonly like cited statistic is that transgender people kill themselves at a disproportionately higher rate compared to other members of society, comparable to like the suicide rate of Jews in Nazi like Germany. So like the two takes as to why trans people kill themselves so often is because of a societal, is because they're treated poorly by society, or by mental, or because they are mentally ill. The right generally takes the stance that trans people are killing themselves because they're mentally ill, and the left generally takes the stance that it's because society treats trans people poorly. I think with men, it's more that it's a similar issue when we're trying to explain the high suicide rate. Um, Men though aren't really discriminated in society like women. It's not as intense as Jews in a Nazi Germany camp. So that would lead you to the other alternative, that we have a mental health issue problem with men in America, and that we can tackle. We can actually work towards that. I think it's important to focus on that, because as long as the male suicide rate is so prevalent, we'll still see issues with gun violence. We'll still see issues with school shooters. We'll still see issues with many violence and domestic abuse cases around the US. And obviously mental health services for men is not going to stop those cases in its entirety, but it's an important step in preventing those cases until we can get more legislature passed in the US, which can completely prevent those events from happening. It's about saving lives and harm and risk reduction until, as a society, we can get progressive enough to actually deal with these problems head on.
yeah. You think a huge issue with this might be also that, like, kind of like in the sense of healthcare, like, America, the reason that we don't have really free healthcare is because it's for the profit of like these pharmaceutical companies and etc. It benefits the government. Do you think that might be a reason why we don't implement that much, like that much of a backbone for mental health in men, is because it won't really necessarily benefit those people at the top 1%?
Definitely, definitely.
Yeah.
I think it's an issue of accessibility. We don't have enough therapists, we don't have enough psychiatrists. I've heard from plenty of my friends, getting a therapist, getting a psychiatrist during COVID has been extremely hard with wait times of months. We don't have enough money going out into like media advertising and like awareness campaigns for men that it's okay, that they have support, that they have people who are willing to listen to them. It's specifically for men. Like I feel like if we're just viewed as a part of the population and we address the populate in the entirety of the population on mental health, it doesn't really resonate with men as much. They'll be more likely to stay in the background, keep subduing these feelings, and just never talk about it. But if we were to start an awareness campaign that specifically talked to men and was focused at men, that people, when they saw it and read it, were specifically resonating with it, I think it would be more effective. So it's like that's personally how I feel about the issues with mental health in men. I think like when we talk about like insurance and the cost of healthcare and stuff like that, that is definitely not a helpful factor. Uh, Men are unfortunately like very stubborn at times. And I'm sure adding a cost benefit or like a cost deficit to seeking help and with the societal effects of coming out and seeking help, it just doesn't make it appealing to anyone to reach out for help.
Exactly. I think it's like insane that the people who usually tend to need therapy the most, tend to be lower income or middle income people, and those are the people who can't afford it. Like it's insane. We definitely need to rethink how America spends their money. That's definitely an issue that we need to think about. So I think the last thing I'd like to discuss today is like maybe just in like short bullet points, what do you think the takeaways are? What do you think society needs to do? What do you think the US government needs to do? What do you think other governments internationally need to do?
I think society, like as a first stepping stone for like anybody listening to this, if you want to make a personal change and a personal difference, I think actually like asking your male friends, peers, how they're doing, what's up with them, checking in on them, making sure they're okay, and being like a supportive person for them is really important. Um, so I think like if they ever come out to you about being suicidal, depressed, anxious, like you really shouldn't, obviously you shouldn't be judging them, but you should really reassure them. I think a lot of men are scared coming out about their issues and scared of judgment, scared that people will think and look at them differently. I know personally I was when I started talking about my personal mental health issues. So as a society, we can all just take a moment and realize that like men are more than just their physical bodies, selves. They have a mental and emotional capacity to them. And we should encourage more men to be more expressive with their emotions and to stop using derogatory terms like junkie, psycho, et cetera, et cetera. Stop making men feel bad, calling them pussies, bitches, et cetera. All these different slurs just to discourage men from coming out and seeking help. It's definitely an active step that we can all take. And then at like a societal level from the US, that's a more difficult question per se. Like I think like legislature to tackle this type of issue really hasn't even been proposed or thought of like yet. I think it could just be more state-sponsored awareness campaigns, or if we put more money into like
Maybe even grassroots campaigns, start from
yeah.
the bottom.
Yeah, like I see a lot of like billboards on like roads for like the vaccine and stuff like that, encouraging people to get that I know are backed by my state, Massachusetts. And I think if more states took the initiative like that to reach out and provide these groups and provide these billboards and signs, it will help people realize like, yeah, I can actually talk about this because I see this in society.
Yeah. This is definitely a very complex issue to solve, especially like with the entire billboard kind of concept. Like imagine trying to implement that in a state like Texas, where good old Texas, man. Okay, I think that concludes our discussion today. Thank you so much for joining me.
Yeah,
And
of
I'm sure
course.
a lot of people will be glad that you brought this subject up because it's definitely not talked about enough. And that concludes the discussion. So I'm going to